Depression is the opposite. People feel sad, blue, down in the dumps. They don't have any fun doing anything. Nothing motivates them, nothing interests them. And I think that when you hear this kind of with me describing it in words, it's one thing, but I think a lot of suffering comes from people who have nothing, gives them any pleasure or reward at all. I think we fail to appreciate how important that normal mechanism is for all of us in our day-to-day lives. And when it's not working, you're really miserable. They can experience decrease in energy, they can have sleep problems, sometimes sleeping too much, sometimes not sleeping enough. They can lose weight very commonly, or alternatively can gain weight. In some cases, for the patient with bipolar disorder who's in the depressed phase, there's some greater tendency. It's like you pull the plug, they crash out of their mania, you pull the plug, and they sleep 16 hours and gain weight over a period of several months while they just have no energy and their body recharges in some way. The most serious thing about depression, of course, is suicide. And here it's important to point out that bipolar disorder is an illness of not only significant morbidity or suffering, but mortality as well. About 15 to 17% of people with bipolar disorder kill themselves at some point during their life. We have evidence that this may be in part genetically related, that there may be some forms of bipolar disorder that are more virulent, if you will, in relationship to suicide. And we see suicide clustering in families, suggesting that there's some genes that are particularly bad about causing suicide. So that is obviously the most serious thing. And I can't help but at this point to kind of say that if you have a family member, a loved one, a friend who you're worried about, I think that it's very common to worry, I don't want to ask him about suicide because it's embarrassing, he'll be embarrassed, or maybe I'll put the idea in his head and he'll start thinking about it after that. All of these are things that people think about that make them reluctant to talk about what's a potentially embarrassing topic. But as a professional, what I can tell you is that if the thought ever pops into your head that this person might be suicidal, I'll guarantee you they've already thought about it. Probably just thoughts and nothing real serious, but they will not be angry if you ask them. They will, more often than not, if they have had these thoughts, they will find great relief in having permission to be able to talk about it. Here's this awful thing is happening to them, these thoughts that scare them really bad, and they feel embarrassed to talk to anybody about it. So it's really valuable for them to have permission to talk to somebody about it. So don't ever be afraid to ask about suicide.